Hello everyone, Dr. Sam Schroetke here of Physical Therapy and Hand Clinic of Hillsborough with another exciting edition of Technique Tuesday. Today I was going to demonstrate a technique called cervical retraction. This is a very important technique that we often hand out. It could be useful for people if they have neck pain that's either on both sides, right in the middle, or on one side, or if they have pain coming into this region, upper trapezius, some people call it the shawl region, or even pain that's coming down into the shoulders, okay? So here's how we would cue that. I would recommend actually doing it in a seated position. So cervical retraction. So you start seated. It's good to have your back supported if you can. And what you're gonna do is keep your eyes level on some spot in front of you, and then imagine that there's a pie coming in toward your face, and you just go straight back. Okay, and you're trying to give yourself a triple chin. Basically, you're going back as far as you can. So I keep my eyes level, chin stays level, and back, and then release. I'm starting from about a neutral position, and then I'm going back as far as I can, and I'm holding it for about 2 seconds, and then I come back to a neutral position. One of the mistakes we make is we see people come all the way out, but I'd rather you stop kind of at a neutral position and then back. I'm going to show that from the side as well. So here we are, my eyes are level, I go back, and then release. Couple common mistakes we see are people will look down when they do it. Nope, that's not what we're trying to do. Or they'll look up, so they'll do this. And that's not what we're looking for either. So pie in the face, eyes stay level, chin stays level, straight back. Other cues that might work for you, for some reason people tend to get this cue if I say pretend an ugly person is coming in to kiss you. So I don't mean to offend anyone by saying that, but for some reason when I say that, they're like, ooh, and they get it. So you're gonna go back as far as you can. That's really important. Hold for about 2 seconds and release, okay? You might have to work into getting your neck back as far as you can. You might only be able to do mid-range initially, but eventually you do wanna be going as far back as you can. End range is where the magic happens. So when you're able to go back as far as you can, that's when you might start getting an alleviation of symptoms. Another thing we can do if we need to add a little bit more force, you do the retraction, and then at the end, with your fingers, a little overpressure. And it just gets you that much farther. So retract, overpressure, and then release, okay? Your physical therapist may prescribe 10 to 15 reps of that every 2 to 3 hours, it depends. This exercise isn't for everyone, so please make sure to check with your physical therapist first to make sure that it is appropriate for you. So there we have cervical retraction, and I'm Dr. Sam Schroetke with Physical Therapy and Hand Clinic of Hillsborough.